If you clicked on this video, you must have heard of public health, especially after that COVID pandemic. It is a super nuanced field, but here's everything you gotta know in just 10 minutes. From infectious diseases, vaccines, to politics, and money. But first, let's answer the biggest question people have. What is public health and how is it different from medicine? Well, the biggest difference is that public health prevents and medicine treats. Public health would try to prevent the general population from getting lung cancer. They do this through smoking education campaigns, increasing the taxes, or increasing the price per pack of cigarettes, while medicine would look at someone who's been diagnosed with lung cancer, then offer chemotherapy or other drug treatments to prevent that cancer, that tumor from worsening. Okay, I don't think it's necessary to dive into the subfields of public health, but just a general overview. It can range from something very computer based and technical, such as biostatistics, to something much more community facing and people based, such as social behavioral health. Now, the broad goal of all these disciplines within public health is to monitor disease, identify outbreaks, or identify a population that's very susceptible to a disease, come up with a solution, and then implement the solution via collaboration with governments, private companies, nonprofits, etc. Now, the most famous product of one such collaboration would be mandatory vaccination. Vaccines were developed around 200 years ago based on a concept that exposing an individual to a small amount of pathogen could help build immunity. You basically nerf that pathogen in the sense we're going to say it's bacteria or virus, teach your body how to fight it so when the actual disease comes, your body is prepared. As of today, many countries have laws that mandate kids to be vaccinated when they're extra vulnerable. But within the US, as of now, because it is the US, every state have slightly different requirements. In general, you are only required to be vaccinated if you're enrolled in a school, but medical and religious exemptions do apply. Other examples of public health initiatives would be seatbelt laws, banning of smoking in restaurants, and even labeling the calories on your favorite Big Mac order. Public health is working, it has been working. Number wise, it has increased the average lifespan by like 30 years and it has averted millions of deaths. Okay, this is really cool, but why should I care? Well, the truth is, we have been at an evolutionary arms race with pathogens ever since the dawn of time. They're evolving because our environment's evolving. We are also evolving, but at a much slower rate. If we don't constantly monitor these diseases, they could wipe us out. I am not talking nonsense. It's not a movie. We have seen this happen with the Black Death that wiped out almost half of Europe's population. And just last century, smallpox took over 300 million lives. That's pretty much the population of US. The good news is we have eradicated smallpox in 1980. And the bad news is it's the first and only ever disease to be eradicated in humans, and that is because it's not zoonotic. Without diving into the details too much, COVID, it is a zoonotic disease because it has an animal host. Smallpox didn't have an animal host. So in terms of COVID, as long as that host species is alive, the disease will persist. Smallpox, thankfully, was not zoonotic. It only spread human to human, not animal to human. That's why we were able to eradicate it. Beyond this, things such as diabetes, heart disease, obesity, it's so common now. And these are non communicable diseases, so different from COVID and smallpox that we just talked about. These non communicative diseases don't spread via coughs or a sneeze. They are simply shaped by your environment, by your lifestyle, by your socioeconomic status. All I'm trying to say is that things change and they change fast. So, in the case that science and government fails to protect you in a timely basis, you gotta have the knowledge to protect yourself. And honestly, I think we've been doing a decent job. Most of us knew to mask up during COVID to prevent getting COVID. most of us. The knowledge of health is important, but it is also very debatable because having that awareness means nothing if the society or your cultural norms prevent you from carrying out that practice. For example, simply knowing that condoms prevent STDs means nothing if your society puts women at such a low social class that they are not even able to even mention this in front of their sexual partner. Moving on, this is a very sensitive time to talk about policy and government. It's controversial, it makes me uncomfortable, but it's important because ultimately, policymakers are the ones to create the largest impact at a population level. At the end of every public health solution, we have to negotiate with policymakers. They get to decide how much tax to impose on cigarettes, where can people travel to during the pandemic, homelessness, gender rights, birth rights, yada, yada, yada. Essentially, policymakers have the power to determine who gets benefited from the limited amount of resources that we have. All that public health officials can do is to find strong evidence to shape that decision. This is also controversial because, as you've seen with COVID and with HIV, diseases can be easily politicized. You must have heard about how COVID was released from a lab in China to attack the States, something like that. But in the end, policymakers are super powerful, but there's one more thing that controls them. That is money. It's all about the money, baby. I will make a separate video on funding specifically, but when we're looking at health, there are three main sources of funding or revenue. You have prepaid funds such as insurance premiums, payroll taxes, and these automatically get pulled whether you use the healthcare service or not. And then in between, you kind of have out of pocket payments. These are the things you pay for when you personally go use these healthcare services. And then on the last side, which is the side I think is most interesting, we have aid slash grants such as USAID and US's overseas developmental assistance programs. This international aid part is my favorite thing to talk about within the economics of public health because, first of all, you get to see the lasting effects of colonialism on which countries and which diseases get the funding. And secondly, you also get to see how powerful some corporations are and how powerless organizations such as WHO, World Health Organization, is. For example, if you look at HIV accounts for maybe 1 to 1.5% of global death. But when you look at the funding they receive, they get almost half of all USA's global health budget. Whereas diseases such as obesity, hypertension, cardiovascular diseases, they account for much more deaths, but they receive so little funding compared to HIV. Well, I hoped you liked this super quick summary of the public health landscape. Thank you for watching. As always, all opinions are welcomed and subscribe to keep updated. Bye!